we've already mobilized the joint and it's all loose in there. And we've done the twist already, so we can maybe go a little deeper this time. I always like to use the breath and noticing as they exhale, press the cross. So this time, as we come into the twist, before we roll them all the way over, again, I can push here like Anjali was using the knee to push across. So then we're actually going to come down, and sometimes you need to support the hip, otherwise it'll fall back. So supporting the hip and then bringing your feet there. So we're getting into the upper body. I'll grab the arm here. Usually palm facing up feels more comfortable. And I'm just going to press away, and here it's a deeper twist again. They're really twisting around. And then you get the ball of the foot into the quadratus lumborum, is like a really tight lower back muscle, as well as along the spine. So they're, I mean, they can't have a pillow, but the idea is you're not rolling over to the side yet. You're just getting the lower back. So just a few presses there, and then you can have them roll to the side, still keeping the feet there. So again, you can have a pillow ready. And so here, again, walking up, and you have the arm still. And so you can actually feel the scapula here and the spine. So I want to be in between the scapula and the spine. And I'm just going to pull back. Oh, I got a little pop there. So you can really get in here and pulling back, and then just moving the feet, and then pulling back. And you can even press the big toe into that soft part. So there's the scapula and then the spine. And you really want, if you can't feel it with your feet, just get in there with your fingers, and then pull back. So again, getting close enough so that you can just use your body weight, rolling back, leaning back. This is, again, no effort on my part, and it's really deep. Yeah? How does it feel? Nice. So yeah, their arm can be behind. And it really depends. Some people are really open. You can get their toes even under their scapula in their wing, perhaps. And some people are so tight, you can barely fit your toes in between the spine and the scapula. There's no room there. So this one might not work for some people. But just to find that. Let's see. So then here we're just going to stretch out this area that's often tight and constricted. So much when we're doing computer work or driving, perhaps. So I just interlace the fingers, and first I like to just squeeze the deltoid here. You can get into the side, the back, and the front of the deltoid, and just massage and work out the shoulder joint. And then once you've done a little bit of that, you're going to just lean back. So you're stretching this whole area, the trapezius, all that, and sometimes their head will even begin to lift. And just asking, is that okay? Too much? Some people it can be a lot. And sometimes you can even get the pinky side of the fingers into the top of the shoulder here, so walking up toward the neck. And like we've done on the calf and the other, if you were here last week, then you curl the fingers and you can do the same thing. Getting into those tight muscles. If you might feel a rock here, a lot of people have a gremlin that lives in there, and you can just find that gremlin and do little circles. And it helps if you take the whole shoulder with you. So as you feel that nice tight spot, you can do little circles. And then I like to hold that rock or whatever that's tight. Then you can just squeeze the neck all the way up toward the occipital lobe, so you'll feel the skull there. So all the way up to the top of the cervical spine. And so I'm actually squeezing both sides here. as I mostly press with my thumb. The fingers are just there support to make sure I'm not on the spine, the cervical spine. So it's just a really easy way to get into the neck. If we had more time, you could even get your forearm in there. Do a lot of really deep work on the top of the shoulder and the neck there. So then we'll rotate to get to the other side. So I can actually, this one we'll probably skip, we don't have enough time, but just to show you guys for the video. So I'm supporting her back here, and I can pull the shoulder back. I can get my forearm here into the pectoralis muscle and the front of the shoulder. Again, is that okay? Does it feel good? So it's nice to get the pectoralis this way as you're opening. So again, you're stretching the muscle and then massaging, applying pressure there. Nice. And then again, you can get into the top of the shoulder. So then I like to find a spot, that spot, the gremlin, either with my thumb or palm, and then you lift the elbow and do little circles with the whole shoulder joint. So again, it's holding a point and moving the joint around, and that really helps release, get rid of any gremlins that are there. So if you're just going to hold it and hang out, it's not going to do a lot unless there's some movement in there, and it's really about getting the blood moving, getting things moving out of there. Yeah. So then we'll grab the arm. Again, you can do lots of joint movements here. I'm going to again switch so that I'm facing their body and do a nice lunge. So my foot's above the head. The palm faces down here. I feel like that's easier and more accessible. I'm going to press my other hand into the hip, the top of that hip where we were with the elbow on the other side, on the lower body. And so I'm just lunging forward, and it's a nice deep stretch. So it's easy to press too hard here. It's really about pressing into that other arm on the hip. So we're stretching the whole side body here up through the ribs. And then you can also press, find the nice soft tissue here where the latissimus dorsi is. And just as you lunge, I'm pressing into that soft tissue right under the armpit. Okay. And then other options, which we won't go into, are just stretching and opening the pec. She's really open, but for a lot of people, this is a big stretch to open the whole inner arm. Then just stretching again the arm down along their side. Nice pull, stretching out this area. You can massage the whole arm here. So again, just squeezing the bicep and the tricep at the same time. Coming down, squeezing the forearm. And getting the hand, just a little squeeze. Of course, we'll spend more time on all that. And nice roll that. Again, I like to just squeeze the knee in, pull back. And so notice how she's a little crooked, so we do that same thing. I'll show you guys one other way instead of lifting the legs like we did. You can bring your leg up in here and cross the feet. That helps. The thing you really want to make sure is that you're under the knee joint. If you're up here, you're going to press into the calves. It's a nice massage, but it's intense for some people to press into the calves. So I get all the way under the knee, and I just press the feet down, and her hips are off the floor here. And I just do that little rock.
It's the best.
And then just making sure the hips are now aligned. If they're not, then you're going to pull back, they'll be aligned. You can go to the other side. So again, finding that. Questions?